Start the procedure by ensuring correct hand hygiene practices have been followed before seeing a new client. To make temporary offloading devices, you will require the following equipment: wool felt or low density EVA, scissors, and Hyperfix. People may often present with a callus or wound in an area vulnerable to increased pressure. Offloading techniques can be applied to deflect the pressure from a localized and distinct area of overload. Caution: this is not a long-term management option. Use only for temporary relief. Padding can be used to temporarily deflect pressure from a particular site on the foot. You must ensure that the person can reach their feet to remove the padding if necessary, checks their feet daily, and has sufficient cognitive ability to recognize if there is a problem. There is sufficient space in the person's footwear to fit both the padding and their foot. There are a variety of designs possible depending on the offloading you are trying to achieve. Each of these have different functions depending on the area you are aiming to offload. Consider which will be most appropriate to effectively offload the desired area. Some of these designs include a single wing pad, double wing pad, U-pad, aperture pad. Measure the size of the yoga mat or low density EVA. You will need to cover the width of the foot and note the area you will cut out to redistribute the pressure. Trace the shape onto the area you will cut out. Remember to consider if you are putting it onto the person's foot or in the shoe. This will change how to trace the area. Carefully cut around the shape of the pad. You may need to double check that what you have traced is the right fit. Cut the edges and corners to reduce the risk of pressure caused by the pad. These should be smooth and not cause any pressure. It is recommended that most often you will stick the offloading pad to the inside of the person's shoe. You will have to consider this at the start to make the right fit. Once secured, ask the person to stand on the pad to test how it feels. Evaluate if it has been applied correctly to offload the desired area. You must explain to the person that this is a temporary measure. If they feel any pain, discomfort, or are concerned of injury, they must remove the pad and return for a follow-up assessment. Teach the person how to check and monitor their feet each day. These devices will require ongoing monitoring to ensure no harm is caused. They will be required to return for a follow-up appointment to ensure there are no problems.